As lung cancer rates started to diminish after the campaigns of the 70s with prevention. I also have 3 teenagers. I don't live in Yarmouth. But I've become increasingly alarmed at the growth of smoking or vaping within the adolescent community, in part because of my kids, in part because of their friends, et cetera. And I've really tried to understand this. Cigarette smoking among teenagers was dropping, and it was falling off. And kids today, if you talk to them, they think it's gross. They don't want any part of it. They don't want to lick an ashtray, et cetera. But we are on the edge of an epidemic. It's been declared an epidemic by the FDA. Dr. Gottlieb is the head of the FDA, has declared it an epidemic. Like most epidemics, when it starts, I don't think we understand it. It's like a storm. Oh, it's going to get worse. How big is it? What are the damages? We won't know till later. A lot of what we will see won't happen. Lead time, probably 20 years for lung damage and lung cancer. And I'm not just concerned about lung cancer. I am concerned about lung damage. The chemistry background is the harder part for me to understand how we get from a liquid to a vapor without heating it in a superheated way. So I could go into the physics, et cetera, but this was an early kind of an effort, and there was a promise, and I actually bought into it initially in my career about 10 years ago. The concept of an e-cigarette for an established adult smoker was that you could get a metered small dose of nicotine on demand. Would that help with smoking cessation? There were some early studies that said yes. The problem is that this has become, for teenagers, a fad. It is very social. They share the vape pens, they share the Juuls, and it has run rampant nationally. I was trying to guess how many guys were on the board, so I printed 6 copies. But this is a long-term study. The University of Michigan has had a study for 44 years called Monitoring the Future, and they measure all sorts of things happening to adolescents. And this explosion is one of the largest increases in usage that they've seen in 44 years. Their estimates are that between 2017 and 2018, 1.3 million new adolescents smoked. Now, I'm saying smoking. Kids, again, won't regard it as smoking. They call it vaping. Oh, it's not there. 20% of adolescents do not believe there's any nicotine in the inhaled stuff when it's nicotine most of the time. The science. Part of the science is we will have to see. If we want to wait 20 years on an epidemic and see what the damage is, we can see it. Nicotine is highly addictive. We know that. So we know that once you have that, you're not going to wean quickly. But in terms of the additives, the polypropylene glycol, the diacetyl, the other chemicals that are in the vape pens to make it from a liquid to a vaporized form quickly, we know that some of that causes damage. The animal studies have been done. Yes, there are case studies where kids are getting admitted with respiratory illnesses, et cetera. But that damage won't be evident because when you're young, your lungs are pretty good. So you're not going to hurt them too quickly, too easily. Across the Cape, we're seeing it. I have, unfortunately, had to become, involved in this and get educated about it. And I've talked to 6th graders who've vaped. I don't know if you guys have seen a Juul, but I brought one for you in case you haven't. This one was taken from a 14-year-old girl. She put her initials on it. There's a little decorative flower. She owned it. It's a $50 or so. Gave her some social status. They passed it around with friends. These are the pods. Most pods are about the equivalent of a pack of pack of cigarettes in terms of nicotine. There is an Crown Market. The kids resell the pods for about $5 each. Do they get them in a convenience store? Probably not. Do they get them online? Some. Do they get them from older brothers and sisters? Yes, but they get them. The statistics are there in terms of how many kids are doing this, but basically 1.3 million. Is Yarmouth unique? No, Yarmouth is proactive on this. Several other towns are are being proactive about this, and I congratulate you. But this is an epidemic, and an epidemic will take a while to figure out how bad it is, when the damage is, and how to curtail it. I have done this partly because I believe in the future and the future of our youth. But frankly, you know, I'm tired of taking care of the ravages. I would want to prevent this next generation from getting there. Now, I'm not talking about millennials. I'm talking about Generation Z, or the iGen. These are younger kids. These are adolescents, and they have a different set of things than millennials. They are growing up in an era of school shootings. They are stressed. They report mental stress. Beyond that, they've grown up in the world of mega information, so if you go on YouTube, you can always find somebody who will rebut whatever and say that, yes, this is good or bad. But if you look at the science behind this, if you look at the chemicals that are added to this, the flavors, et cetera, it adds up to a real storm, and that storm is coming. Now, I know that you guys have been proactive on the flavors. That was a large attractant to kids, mango, cherry, creme brulee, et cetera. The FDA came very heavily down on Juul about that. The negotiated bargain was menthol. Well, menthol is much more appealing to adolescents, and more adolescents smoke menthol than non-flavored. Adults, the opposite. Juul is, a third of Juul was recently bought by the parent company for Philip Morris for, I believe, $13–15 billion. They bought a 35% share. Atria is the parent company for Philip Morris. They're the ones who bought Juul. So this is not small business. A third of it is Philip Morris. The Altria company also bought a Canadian cannabis thing. The kids can refill the pods. They do add THC, et cetera. And it's a transition. It's a big transition from one addictive substance to other substances. But my particular concerns as a surgeon, as somebody who's looked at lungs for the last 30 years, is lung damage and the nicotine. And the lung damage is we won't see it, but we know it's been there. We know that some of the additives cause that. When you do the animal studies, they definitely have diseased lungs. But your lungs are a filter, so if you damage your filter a little bit at a time, it takes a while to add up. I don't know what to add, except I'm passionate about this because I don't want to spend the next 20 years of my career having to fix the next generation.
Question for you, just on vaping addiction. The withdrawals from Juuling, is it different than withdrawals from just cigarettes?
Again, this is very social. The nicotine is nicotine, and nicotine, you know, in animal studies, the animals will do amazing things to get to the nicotine. But the social aspect of this is most of the time this is shared. I think you had educators in. This is in every school system that I've talked to, and it's in every middle school system that I've talked to. And they're talking about, you know, do we get sensors in? But the teachers can't. This has everything that appeals to a kid. It's electronic. It's small. It's easily concealed. In a public forum, to say that we've had this occur in the hospital, it would be hard to deny that people can use these very quickly in the hallway, and you would not see or smell that. But I can't answer to the nicotine addiction long term because we're making that generation now. So in 10 years, I can tell you how many kids were able to wean off it, but all I'm seeing is kids going on it.
Yeah, we've heard it's very difficult to get off the vaping from some of the students that are on it.
Yeah, and we've talked about this is across the school spectrum. Athletes, good students, bad students. This is a parent issue in 2019 for 6th grade and up, and that's my target right now. I'm not really planning to do much with the high schools. I'm more worried about the middle schools. It's a social status thing. When you have one, I think if you see that and see that that person took time to customize it, partly because they don't want to lose it into the mix, but also to say, hey, this is my thing, you know?
Any suggestions for the board? I know what you're focusing on. We're trying to figure out as a board, and our mission here is to improve and maintain the health of the people living in this town. So we're open for advice.
Yeah, I mean, I meet established smokers all the time. And to be frank, if I could get people to quit smoking, that's the business I should be in. I have to very often see somebody who has a cancer of the lung who then needs an operation and they're still smoking. So what do? I can get them to decrease the dose. That is one thing. You can offer, you know, acupuncture and feedback. There are definite, you know, go to the patches, et cetera. For a while, I even bought into the e-cigarette concept. But once you're an established smoker, it's very hard to do. But I know that most people can reduce the dose because they have that first cigarette when they wake up and have their cup of coffee. For kids, the school systems are going to do what they can. But the appeal to the kids is very much on the basis of flavors. And I put menthol as a flavor. And clearly menthol is more used by young kids than adults, and vice versa. So if we're not trying to, if you're an established smoker, you just want the nicotine. Do you need the flavor? No, you want what you've already been used to for 20 years. So yes, I think the flavors, yes, increasing the age. The online sales, can you address that? No. But that is a particular concern, is the flavors are an attractant for the kids. The devices are an attractant. It's estimated that 2/3 of all the Juuls end up in the hands of adolescents. They're 70% of the market. I don't want to single out a single company, but it's called Juuling. It's not just vaping. It's e-cigarette, whatever. It's Juuling for the kids. That's what they do.
It's the equivalent of Kleenex is a tissue. It's just
Right.
It's a brand.
It's a brand.
Board have some questions, some comments, please. Bruce, it's upsetting to listen to this.
It's become a hard thing for me to watch because I you know, it's a little bit like you pick a scab, but then you find out there's a much larger problem. The more I understood this, the more I've talked to parents, the more I find, oh, this is real. A lot of parents don't understand it. I think that the education piece is the part that I care about, but parental education is huge. Maybe the board could address that in some fashion, because a lot of parents don't understand it. The kids have convinced them, oh, Mom, there's no nicotine in that thing, you know? Or what is that? It's a flash drive. No, it's not a flash drive. But as I've learned about this, as I've had to learn about this and understand it, and when I talk to my kids, when I talk to their friends, this is a real epidemic. It's out there, and it is flying below our radar because, frankly, we're doing stuff all day. But you know, I know you had some educators in, but they're having a tough time with this too, really tough time.
I mean, just with regular cigarettes, nicotine, people start to have signs and symptoms within a couple of hours. It does happen. It could be 4 or 5 hours people need a cigarette. I mean, it's addictive substance. I don't know what happens with the kids.
My training in thoracic surgery came in part through the military and in part taking care of the World War II vets. There was a sort of an understanding of why those folks smoked. You know, it was a very stressful environment, et cetera. The nicotine has a calming effect. this is a stress generation. And there is a feedback for that. Yes, there's a feedback loop. They get something out of it. Beyond that, relaxation, is that good? No, it's an addiction. It's one of the 5 most addictive substances. Put it up there. It's not an opioid, but it's that addicting.
It's equivalent of heroin from what I read about.
In terms of addiction, in terms of what animals will do to get the next fix, yes.
Okay. Anyone else? Thanks for taking the time from your practice to come in. Appreciate
No,
it.
I'm going to sit here. I want to hear it out. Appreciate the board.
Thank you. Okay. Director Murphy, who's up next?
Yes.
Good afternoon, Director Murphy, Chairman Bosky, and members of the board. Appreciate you having me here tonight.
Okay, thanks for coming in.
So, my name is Jess Oyer. I'm an attorney with Fletcher Tilton, and I represent the Coalition for Responsible Retailing, or CRR. You may recall that from the last time I was here. The last time I was here, I discussed a few points in brief, and then in the interim, I submitted a letter to the board, which you may or may not have.
They have your cover letter, but not all the
Yes.
documents. So they
Yes.
have that, and they have the last one from the meeting before.
Thank
So
you.
they have your last 2.
And after I did submit that letter, Director Murphy informed me that the attachments would have to be printed out and submitted to the board separately. So, due to the volume of some of the attachments, so I do plan to do that. I did want to mention, however, that the volume of the attachments and the volume of the materials relevant to this topic is extensive, and if this board doesn't feel equipped, and I don't mean that in a negative way at all, if the board doesn't feel equipped to take into account all of that information in a timely fashion to render a decision, then again, I think that just stresses the fact that this board, should take as much time as necessary to factor in all of that data. I would also mention that, the FDA is currently in the process of doing the same thing. They have significantly greater resources. They have scientists on staff. They have people that can sort of analyze this information on a more expert basis. And once they render a decision, I think it'll be easier for local boards such as yourselves to, take their, not necessarily follow suit if you're not required to, but take their decision and use it to inform your own decision. And then I think you'll be in a much better position and on much more solid footing. So that's one thing I just wanted to say to begin with.
Just in regards to that, I started working my way through it. It was close to 300 pages that you had sent, and it's obviously only one side of this. There's information obviously on the other side if there's an argument. So I would, as I had mentioned that night, is try to limit it to the health and medical journals that are well respected and peer reviewed, and that would be really very helpful. Okay.
Sure.
To get more of that material read and reviewed. We take this very seriously.
Of course. And the only reason I brought that up is because, there was some indication that it was too voluminous to be considered, but given the importance of the material, I just wanted to
We're going to do
mention that.
the work. Not everyone here has access, I believe, to a computer. There may be one individual who does not.
Sure.
So
I do have
deliver it.
I do have printed packets with me
Perfect.
tonight that I plan to
Great.
distribute before I
Okay,
leave.
thanks a lot.
Sure. So getting into sort of the issues at hand. First, I want to state that obviously the prior comments were very compelling, and I want to note that I'm not here on behalf of the CRR to argue that these products are good for the youth, so we should ignore the problem and everything's fine. That's not the case at all. We agree that there is Yarmouth has identified a problem. That problem is widespread youth use of these products, and that problem needs to be addressed. Where we differ is that despite the good intentions, behind the board's desire to address these problems, those good intentions don't necessarily result in good regulations. And the regulations that are currently being contemplated, I don't believe will actually achieve the ends that the board seeks to achieve. And I mentioned some of those reasons last time. I'm going to go through briefly some different points. And if you have any questions along the way, feel free to interrupt, and we can have a dialogue.
Great.
So first, there are harm reduction benefits presented by non-combustible products, and that includes, all class of non-combustibles, which is larger than just the e-cigarettes. So you have snus, dip, chew, and you have your e-cigarette products. And the flavored, the mint, wintergreen flavors of those snus, dip, and chew would be restricted by the regulations you're considering, as well as, the entirety of the e-cigarette products. So as a result of that, you would be restricting an entire class of products that pose less of a harm to adult users than the traditional combustible cigarettes. Now, the previous speaker did mention that there's, we don't know what the full harm is, and it may require years of data to come in, but we do know what the harm is presented by cigarettes, and it's substantial. And if you have a subset of products that, there doesn't seem to be the same risk profile associated with those products, and certain users of combustible cigarettes have been able to transition away from combustibles and quit nicotine and tobacco products entirely by using them as sort of an intermediary step along the way towards quitting, then I think it's important to keep those products on the shelves of your local retail stores in order to allow your adult population to have access to those products. By removing those products entirely, and sectioning them off to 21 or older stores, you're essentially, again, channeling your adult users back to combustibles and, encouraging them to use a more dangerous product. And I don't think it's a sensible health policy to seek to protect one portion of the population when you may also be working a detriment to another portion of the population. And in fact, the adult population is, I'm sure, larger than the youth population. So, the detriment may have more negative consequences than any positive benefits of the potential regulation. The next point I wanted to make is that there are a whole host of less restrictive means of achieving what this board seeks to achieve. And they're not only less restrictive, they're actually more targeted. So I'll go through sort of a brief list of potential measures the board could consider in advance or in lieu of considering pulling these products off the shelves of stores. So one of the concerns that's often raised by the proponents of the regulations is that the mere presence of these products in retail stores, in full view of the general public, has some normative influence, and if the youth see those products on the shelves, they think that they're not detrimental to health. How can they be bad if they're being sold in stores? So one way of addressing that would be to place the products below the counter, an opaque counter where they can't be seen, or in a cupboard behind the counter. That way the general public does not have view of those products, and anyone coming into the store looking to buy the product would have to ask for it specifically, and then they'd be ID'd, obviously, and then the clerk would retrieve the product from under the counter or behind the counter where it can't be seen and provide it to that particular of-age customer. And that addresses that normative influence problem that's often raised. Another potential measure would be to restrict location of advertisements. So, that goes to the normative influence again, that the proponents of the regulation are concerned with the advertisements in stores. If there were some way to section advertisements off, have them located in only one area of the store, or limit the number of advertisements, then I think that could address that problem as well. I think limiting the number of products sold to any one individual could address the scenario whereby one individual might be buying in bulk and distributing those to underage individuals. So let's say you have a system where either there's some informal system on a store-by-store basis where they're sort of trusted to do this on their own, or you could have something like the statewide regulation on, Sudafed, where anytime you go and you buy Sudafed over the counter at a pharmacy, they scan your license, you go into a registry. If you happen to be buying vast quantities, then something gets triggered in the system, and they probably look into you a little deeper. If there were something similar in the process of purchasing the products that you're concerned with, I think that would allow the town of Yarmouth to have a better idea if and who any individuals might be who are buying these in bulk and redistributing them to the youth.
On that point there, what type of product would you be visualizing? The vaping device or the vaping pods or cigarettes in general?
It would really be up to the board, but I think the pods would probably be the most effective item to target, simply because that is essentially where the nicotine comes from, right? So any individual only needs one device, but it's the pods themselves that can be sort of recirculated through. The next thing would be the purchase, use, and possession laws, which I discussed briefly last time I was here, but I do want to make a quick additional point. You know, I sort of mentioned this briefly the last time I was here, but I want to stress it again. Any sensible regulation, in my mind, and I think the board would agree, has to disincentivize the behavior it's seeking to curb. And in this instance, you have a regulation which is targeted at the stores. The stores haven't done anything that you're seeking to change. What you're seeking to change is the youth behavior. And there's nothing in this regulation that targets the youth. And that's why we stress the efficacy of the PUP law, of the purchase use.
Interrupt on that 1 second. I don't think we're just addressing the youth. Okay, I think we're looking at the general population. The doctor came before you, yes, that he certainly is directing his effort to the young people right now and also in the future when hopefully they're not seeing him. But so just keep that in mind. We're not just focusing on the youth here.
Sure. And just, that being the case, I think the epidemic that has been raised is one that relates to the youth. So I think the purchase, use, and possession laws does target that problem in a much more sort of precise fashion, because...
Let me just interrupt one more time. Are you referring to the PUP, the PUP?
Yes.
So that's purchase, use, and possession, as I recall?
Correct.
Why don't you just explain for everyone here what that means and for the people listening at home?
Absolutely.
Thank you.
So in 45 states within the United States, it is currently illegal for an underage individual to purchase, to use in public, and to possess in public tobacco products. And in Massachusetts, it's also illegal to purchase, use, or possess marijuana and alcohol. In Massachusetts, it's not illegal to purchase, use, or possess tobacco products. And so in the states where PUP laws are in effect and applied to tobacco, law enforcement can actually confiscate that product from an underage user if they're witnessed using the product on a public street, public walkway, and potentially issue a citation. Now, I assume the board doesn't want to penalize the youth to a great degree, but I think there's a certain disincentive that comes with having an interaction with law enforcement, period, and then having some form of citation issued, whether the first one has no monetary penalty whatsoever, and hopefully that's the only citation that's ever issued to that individual, and then maybe there's a stepwise sort of system where there's a small financial penalty the first time, et cetera. It's really aimed towards having a chilling effect. So once word gets out that kids are getting approached or getting their jewels or whatever it might be confiscated, then other kids catch wind of that and they stop using. Whether they stop using in public as a first step, and then over time they stop using, period, because in public is really the only place where they're socializing anyway. The goal would be obviously to reduce the youth use of the products generally.
Are there towns who are enforcing that in Massachusetts? I mean, I'm not sure. We certainly haven't spoken with the police department and where their efforts would go. Is it being enforced anywhere?
I am unaware of towns in Massachusetts that are enforcing it. I do know that the proponents of the regulations usually respond saying the police would never support that, right? But if the police are already doing the same thing with marijuana and alcohol, I don't see why it would be such a burden to add tobacco to the list of things that they're able to confiscate from underage individuals. I think that's a really strong alternative to the sort of regulations that the board is considering. And the last thing that I mentioned last time was the creation of a task force, local task force, to incorporate sort of all the boots on the ground, made up of potentially one member of the board, one proponent of the regulations, hopefully a local proponent, and one of your local retailers, because the retailers do have a significant stake in what's going on. And, from our position, they're sort of being inappropriately targeted or demonized as sort of the cause of the problem. And even if it's not the board's opinion that they're the cause of the problem, they're still bearing the brunt of the regulation in the sense that it's potentially putting them out of business if they can no longer sell a class of products which comprises a significant portion of their revenues. So it puts them at risk. Lastly, and this follows from that point, there's been no proof offered that the products are in fact coming from the stores. And the previous speaker actually said, are they getting it from retail stores? Probably not. It's more likely that they're getting it from the internet or from older individuals who are buying it for them. And we know that the compliance data from the FDA does support that. I mentioned last time that from 2013 through 2018, there's a 90% compliance rate in the town of Yarmouth. One of the speakers in the last meeting suggested that, we don't know how many spot checks actually occurred, so it could have been just a handful, and 90% could be a little bit deceptive. But I went back into the FDA data, and there were 203 spot checks between 2013 and 2018. And of those 203, 183 were successful. And it's also telling that of the unsuccessful portion, only 3 of those involved electronic products. So the rest, if you look at the list, and I can actually provide the list, I printed out 7 copies, I can provide that along with the other materials tonight, actually had to do with packs of cigarettes or cigars, so traditional combustible products. And granted, that doesn't necessarily tell us much because the FDA might be directing these kids what to take, but it may suggest that a store is actually less inclined to make a mistake when dealing with the sales of e-products because they're more in tune to the concern in the town, and therefore if someone of questionable appearance comes in to try and buy an electronic product, they may be more inclined to ensure that they properly ID that individual. And I would just add that, allowing, so removing these products from the shelves of the retail stores as these regulations would cause us to do, and sectioning them off to 21 or older stores creates a situation where you're putting a lot of faith in a class of stores that really hasn't been tested. So we don't have reliable data going back years on the compliance for the 21 or older stores. Furthermore, I think there's more, inclination for sort of illicit things to be going on in those stores because of the fact that they enjoy sort of a separate status, and I think they get less attention from authorities because authorities assume only people over 21 are going in there. There's not much to worry about. But if you saw recently in South Boston, one store is being shut down because they were illegally selling marijuana without a license to customers who were coming in. So I think there's, it's sort of a burgeoning little cottage industry, and it's not as tightly regulated. We don't have a lot of compliance data, so putting a lot of faith in them, I think, is misguided at this point. Again, I would stress that there's a wealth of information that should be considered by the board before taking any action, and potentially even waiting for the FDA to render its decision would be a wise maneuver as well. I will provide the hard packets to everyone at the end of the meeting, and I'd be happy to discuss the details of the attachments therein at the next hearing on the March 11th, I believe. And I'm happy to engage in a discussion if anyone has any questions as well.
Can you just reiterate the years for the compliance, the beginning and the end years you have for the compliance?
2013 to 2018, so 6 years, 6 years of data.
Is that Massachusetts, Cape Cod, or?
That is only Yarmouth.
So there was how many FDA checks?
203.
203. Yeah. See, they don't send us those checks.
I have a printout of the spreadsheet that has all of those that I'll provide to everyone at the end of this meeting as
so
well.
203 checked, and how many sold, did you say, during that period of time?
203 checked, 183 successful, so 90% compliance. There were so the difference obviously being 20. And only 3 were electronic products.
I mean, the health department, you've done a great job with this, Bruce. That doesn't, I mean, people do come in and they're here for getting fines and all, but what's something positive about selling electronic nicotine systems? What's something positive about it?
I mean, I'm not, I don't necessarily.
Other than income, obviously, and we take that very seriously. These are businesses in our town.
Right.
But otherwise, as a product.
I personally am not a consumer of the product, but I would simply say that it is a legal product which people who are of age can legally purchase, and there's no reason to make it more difficult for individuals who are of age to purchase those products, especially when we have no proof that the mere presence of those products in retail stores is the source of the problem, is the source of the youth getting their hands on the products.
And that's something positive that it's providing?
Well, I don't know that it needs to provide anything positive. I mean, there's a lot of things, you know, if you ask what positive effects does alcohol have for society, I don't know that you can genuinely give an answer that says yes, there's something positive. But it's still a you know, a product that individuals can legally use and enjoy, and I think restricting their option to do so is frankly undemocratic. I think there has to be, you know, at least if there's going to be a regulation that is so far-reaching as to remove an entire class of products, I think the whole town should be involved as opposed to just the board. Again, I don't mean to denigrate the board in any way. That's your job to consider these things.
No, I get the point. It's a good example. You're giving an analogy about alcohol. It's just it's hard, at least for me, to compare the two. Where alcohol is so well regulated. When you go in the store, you know what you're buying, whether it's percentage of actual alcohol or brand to brand. It's a lot easier than what's on the market right now for the e-liquids and so on.
You know, that might be true. But at the same time, you know, there's certainly a problem with youth use of alcohol, and there are products that do hit the marketplace every once in a while that have to, you know, a second look has to be taken at them. I know Four Loko was one a couple years ago. I don't know if that rings any bells with anyone.
No.
It was an alcoholic product that raised some eyebrows. I think it was on the market for several years and ended up not being on the market for very long. But, you know, again, I think the crux of the issue is that a product doesn't necessarily have to have redeeming value for it to be saleable. You know, people have activities they engage in which aren't necessarily, you know, in their best interest, but they're able to make those decisions. That's you know, why we live in a society where people are free to make decisions for themselves. And taking away those options, I don't think is the right thing to do. I think, you know, we still need to address the youth use problem, but I think that can be addressed in other ways.
You just something, get a comment or not? Anybody?
I just wanted to make one comment about the statement that was in the letter. At this time, anecdotal evidence has been offered by various individuals alleging that minors are somehow obtaining or purchasing non-combustible tobacco products from Yarmouth's local retailers in vast quantities. I never have heard that.
Well, so during the last hearing, it was very clear that, you know, the concern, the reason we're here, is that there is, quote unquote, an epidemic relating to youth use of these products. Furthermore, several of the speakers, Dr. Hartman in particular, was pointing to the retail stores as being the that source whereby the individuals are obtaining these products. And so if there's an epidemic, in my mind, you're talking about a vast quantity of products. And if he's saying that that the majority of them are coming from retail stores, then that's where that statement is being weaved together.
Because that's really not an accurate representation, as you know, of how our retail stores have performed with their performance
No.
checks and
So
compliance.
absolutely not. And my point was there are assertions to that effect coming from the proponents of the regulation. And our position is that is incorrect, and that's not in fact the case.
However, we are still talking about retail stores as being the source of some of the product, even though it might not be directly to the young people, but through people who are of age to purchase it.
And I think that could potentially be true, but I don't think that's addressed by the regulation, because as soon as you move the products to the 21 or older stores, those older individuals who are making the purchases on behalf of the younger individuals are going to continue to do the same thing, just at the different stores. Or the internet sales that were taking place previously are going to continue. And because the regulation doesn't disincentivize the youth, you know, directly, there's no incentive for them to change their behavior. So this regulation gets passed, the products get removed from the shelves of retail stores. If I'm a 16-year-old, I'm like, okay, if that happens to be where my older brother went to buy it for me, I'm going to tell my older brother to go to the next store, or I'm going to go to the internet. I just don't see that having any practical effect on youth use.
One other point, you talked about the the 45 states that regulate nicotine and having a chilling effect, and yet we heard earlier that 1.3 million new vaping adolescents came about last year. So it doesn't sound like that pup law is having a very chilling effect.
And that's something that we could potentially look into further, you know, the comparison between states that have PUP laws effective as to tobacco and states that don't, and what the difference in youth use is. And I can see whether there's data available on that.
That's all I have.
Anybody else? Okay, it's informative, I appreciate that.
Thank you.
Thank you very much for your time.
You'll stick around for the
Yes,
meeting?
I'll
Great.
be here and I'll distribute the packets after the
Okay.
meeting.
Thank you.
Thank you.
Perhaps there's someone from the,
Parents?
yeah? Are there parents here? That would be helpful. I mean, people here to ask, just listen, learn, can ask questions, give us opinions. If you're here, please step up. We're friendly. If there are parents. Okay, parents, there we go. Okay.
I'm a parent. Unfortunately, I don't have a teenager. My son's 31 now, but
Just give your name for the record, for the minutes.
Linda Devon.
I'm sorry?
Linda Devon.
Okay. good.
And I think that there needs to be more education for the children, and there needs to be more education in the homes and for the parents, because you are what you live, and then it gets contributed out into society. So we need to try to take care of, you know, there's a lot of broken homes, there's a lot of dysfunctional homes. I know I've raised myself on the street since I was a youth, you know what I mean? So whatever is going to happen in the world is going to happen regardless of a regulation or whatever, because people are going to get their hands, you know what I mean? And it's just going to happen. And it seems to me that the parents have to be educated. The parents have to educate the children, and you can't start educating a child when the problem's already existing. You got to start the education when they're able to talk and listen, and you have to love them and love them positively and educate them from the young age up, and then they won't be. My son's 31, he's never touched a cigarette, a drug, you know, does a little bit of that fantasy football. I don't know nothing about the computer, but you know what I mean? I didn't let him go out too much because my past, he wasn't that social, but he went to school, and his girlfriends would say to me, he won't even go to a party where people smoke pot or anything, you know what I mean? So, and I was a single parent, but I think people have to address the problem that once there's already a problem, you can't turn it backwards because the problem's already there. You can't start educating then. You have to start educating at an earlier, basically when they come out the womb these days, because it's a proven fact that a lot of the shootings and a lot of the activities that are going on right now are coming from the younger youth. So obviously there's more problems in the homes than in the stores. So somehow if something can be addressed that way, then
Okay.
we might have better results.
Okay, thank you.
Thank you.
Okay, anyone else along those lines? Sure.
I have a question. Aaron.
You have to be in front of a mic, otherwise no one's going to hear you at home listening to this.
So I just had a question as a parent. If indeed regulation has had a chilling effect on these sales, why is it that Philip Morris would make a $13.5 billion investment in Juul? That seems sort of contradictory to me, that if things are so slow, why is such a large amount of money being invested in a product that's not really, as we watch a generation of established smokers, and we have said we can help you to an extent, why are we now reaching for a new generation with that sort of investment if it's a chilling effect? I also not sure you can put an epidemic in quotes if it's coming from the director of the FDA, because we also quoted the FDA as a viable source. Well, the head of the FDA has declared it an epidemic. You can quote him on it, but I wouldn't say epidemic. It's an epidemic. The statistics on youth smoking are there, and I do think that maybe the board has an obligation to show the youth what your community stands for, what is acceptable and what is not acceptable in terms of sales of products. Yes, maybe the kid can get it somewhere else, but if it's not every time they go into a store to get a quart of milk, they don't see it. Maybe it gets one less piece away. Maybe you say something to them, no, we can't really support this. This is not a good product.
Well, if it's good business, okay, from the tobacco industry, and if these products can be helpful for people to get off of nicotine or hopefully off of tobacco, why don't we see CVS or the pharmacies selling the products? I mean, it would seem if it's going to help someone stop smoking or reduce the amount of smoke. I mean, if business is that good, you have a company that's got 10,000 stores literally in this country, and they were selling cigarettes 5 years ago in this town.
First of all, it is good business for me, but I hope that nobody ever has to see me about it.
Right.
Secondly, I think maybe at a corporate level, some of the larger stores have said, you know, maybe this isn't where we should be. And in terms of, you know, business, I mean, those are business decisions, but we know that the costs of this established, long American established tradition of cigarettes has weighed very heavily on my profession,
Right.
On the health of our country. And yes, we want people who, we don't want to take away something, but I think as a country we work really hard to say this isn't healthy. This isn't healthy. So when we started seeing a decline in overall cigarette intake, when we started seeing youth decline in overall cigarette intake, then our business dries up a little bit. So what do we invest in? Well, I think we're investing in e-cigarettes.
Okay.
I wish we weren't.
Dr. Spillane,
Yes.
you probably have surgical colleagues that do surgery in other parts of the body that are
Yes.
affected by cancer that's been proven to be caused by.
Well, that was the funny thing when I heard about, you know, well, there's other alternatives such as chew. I have several colleagues, you know, oral tobacco is not all that much a better alternative when you see people with oral cancers, tongue cancers. I could pull some of those colleagues in here very easily. And yes, there are other alternative tobacco products, but my vascular colleagues certainly see the effects on the bloodstream. I can speak to the lungs. It's very damaging. Bladder, renal, kidney tumors, you know. No, not a heavy association with breast cancer or colon cancer, but there is still some. But in terms of oral products with menthol in them being better, I think anybody with an oral cancer would say, not really, no.
I think one thing the board needs to keep track of, certainly I do, is the subject of nicotine versus tobacco, to make sure we're keeping, in some ways they're separate, obviously some ways they come together. It's just a thought I just had.
What do you mean by that?
Well, they're products that just have nicotine, really.
So that was
two-
some initial enthusiasm on my part in saying,
Right.
okay, nicotine itself is highly addictive, but we already have an established group of nicotine-addicted people. How can we help get away from some of the inhaled tar and other inhalants, which are carcinogenic? And I thought I really truly believed about 5 to 7 years ago that e-cigarettes might hold some promise. Why? Because we've really not seen anything else work well. Nicotine gum, some people take it, but they put it down. It works for a few people. Nicotine patches work. So does hypnosis, so does... But nothing is really easy beyond a very entailed program. So I was hopeful that the e-cigarettes could at least get that done. But then when I started realizing, how are you getting that nicotine into a vaporized form? It's additives. There's a battery inside that e-cigarette. There's a coil. The coils contain heavy metals. A liquid passes through a superheated coil, many different coils. What's on those coils? Heavy metals. What's in the liquid to help vaporize it? Polypropylene glycol, diacetyl, et cetera. These are not products that you want flaming into your lungs. Menthol does suppress a cough. That's great. So what we're doing is we're suppressing the body's response to an irritant.
The heavy metals are coming from the coil. From reading about it, they were talking about lead or cadmium. So that's where the metal comes from?
Yes. And there's some concern about that. But again, the investigatory work, the animal work is being done, and there's some early studies. And I have articles that I could provide to some of that. I didn't come fully equipped for that today, but
Okay, thank you.
that's coming. The science will be there.
Great, thank you. Who is? Someone else? Oh, great. Come on up.
Said it's coming delivered, Hi, Ryan Doyle. I have two boys in the DY school system, high school, and younger kids. Going to the education in the home, we've printed out papers, we've talked to the kids, we've brought them to the doctors. Nothing is stopping them. And I assume that's the addiction, I don't know, and I want to be cool and use the product, whatever it is. In our house, it's the Juuls. You can take away their chargers, they cut up phone chargers, and it doesn't matter what you do, they get them. And even in DY and Yarmouth, even 14-year-olds are able to go into some of the stores and buy them without being ID'd. So I hope something is going to be done, we have, as parents, we have no idea what to do to help the kids, because even the doctors, if you're an adult, you can go get the gum or other products that can help you, and they don't seem to recommend those for the kids. So it's tough. It's scary. And I hope you guys can figure out a way to help that. So
Thank you for coming in.
Hi, my name is Shelley Nunes, and I am a resident of Yarmouth. And hi, thank you for this. Very informative. I'm trying to quit smoking, and I started buying what the doctor was talking about, the e-cigarettes. But they also have the ones that you can buy where you don't need the oil, and you snap on a cartridge. And I was using those to supplement smoking cigarettes. And I have to have surgery. And the doctor told me that I couldn't even smoke those. He said because there wasn't enough scientific information that he could say it was a safe thing to do, because smoking will prevent the healing of the bone. And talking about not having them in the stores, people can stop bootlegging. They can go somewhere, buy cartons, sell them on the street, like they sell anything else on the street. So, taking it out of the store doesn't mean it's not going to get in the hands of children or young teenagers, whatever. So that's all I had to say. Thank you.
Okay, thanks for coming in. Great. Somebody else? Come up and sign your name and introduce yourself.
Hi, I'm Christine Greeley. I'm a Yarmouth resident. I'm a retired school administrator, and for the last 47 years, I've spent a great deal of my life working on issues affecting youth. I started out in '72, actually, at a hotline and drug counseling program, and I've progressed through the years. I am currently chairman of the Yarmouth Substance Awareness Committee, and I'm also on a regional school committee. I am not here presenting on their behalf. I'm not making statements on their behalf. I'm making statements on my own behalf, and just because I want you to know that I've stayed very active on the issues that are very, very important to our kids and our community at this point. I think the important thing that's going on here, and that a lot of what people have talked about, and I can't begin to thank the doctor enough for presenting the kinds of things that I think are so significant about what we're now finding in the medical research and in what's going on nationally. But the other part of it is the whole issue of social norming. And with social norming, what we're saying, and I think that you particularly as a Board of Health find this quite common, is that what is it that's healthy? What is it that's okay? So the allowing of the sale of these products and the saying that it's okay, it gives the message out that it makes it very difficult for parents to argue with their children about what's correct about all of this. It is causing a nightmare within our school districts, and I don't care whether they're here on Cape Cod or whether they're off Cape, in terms of the use and abuse of vaping in our school buildings, whether they are with simply the oils, with the fragranced substances that are placed in these, whether they are actually with marijuana oils in them. They are being confiscated on a daily basis in school districts. I don't care where you are. It is very difficult. I mean, school administrators will tell you they walk the halls and they can smell the strawberry, they can smell the melon, they know what's going on and they're attempting to deal with it. But the idea is, well, everyone's doing it, Well, the fact that, quote, everyone's doing it or that it's cool doesn't mean that we as a community should be condoning or supporting it. Amongst the things we do know, and I was glad the doctor talked about it, was the FDA basically came out with a directive to these companies who've become multi-billion-dollar corporations in a very short period of time, saying, stop your marketing to kids, that this is what was happening, that you were really working on this whole idea that this is cool, this is okay. And so we know that a lot of that is going on. I think that the issue of, gee, it'll be harmful for businesses. I'm really sorry, but there are a lot of ways to make money selling things. It does not have to be selling these products. And I particularly was offended over a period of time earlier this year, or late last year, when I was in other communities where I actually saw some store chains where they had signs up where they were offering a discount on buying Juul products. I mean, it was an amazing kind of thing to see. As a matter of fact, I made it a point to not shop at those stores. But part of the whole, canard of just ban it, and just sell it to over 21. I think that even the attorney said, but that's a problem, because what happens is it's amazing how these things get shared with the under 21. It's the kind of work that you all have done on alcohol, and that doing the stings and other kinds of things, because we know there's people in parking lots who are even encouraging friends who are over 21 to go in and buy them a little something as they go. One of the things that we're looking at very actively in this community, and there's been a lot of work done, under your auspices, is the whole issue of prevention education on a whole variety of things. We're looking at prevention education about alcohol. We're looking at prevention education about drugs, and we certainly are starting in now, and there's things, even there's seminars, there's webinars going on right now sponsored by the county on the whole issue of vaping, because it is really, really out of control. And so I just want to say to you, listen to the medical research to the kinds of things that we know are going on, and then really taking a good hard look at supporting this idea that we as a community are saying as our social norm, this is not healthy for us of any age at this point, and we will not condone it. And, you know, it could be maybe you do have to go find it somewhere else, but we're not going to be participating in this, and we are taking a stand against this. And I thank you for the work that you're doing.
Thank you for coming in. We haven't had anybody from the retail. We do. Good. All right. That's great.
Maybe I'm an appropriate person to start, and then we can turn it over to the independents. My name is John Scher. I'm the Executive Director of the New England Convenience Store and Energy Marketers Association. I represent many of the retail...
I missed that. Can you make sure you sign in and write that down?
Yeah, do you want me to say it slower? I can...
Or just write it down. That's the way I had mentioned it. And just so when the minutes are done, so someone will get it right. Just put down the organization. That would be great.
Not a problem. So many of my members are in the city of Yarmouth. And I thought that the people who spoke before me on both sides spoke very, very well and covered many of the issues that really need to be addressed. But I just wanted to highlight a couple more in the interest of time and other people that have other interesting things to say. But I think it's first really important for you all to know that retailers stand with the board and law enforcement when it comes to keeping these products out of the hands of kids. I think far too often retailers get looped in with part of the problem versus part of the solution, and that's just simply not the case. As Jess had spoken to, I think he said it was 90% dating back to 2013. In 2018, it was since January 1st, 2018, it was 97%. So retailers do a heck of a job in keeping these products out of the hands of underage youth. In fact, a retailer can lose, if there are fines and then loss of license. Loss of license is a serious thing for a retailer of tobacco products. Tobacco represents, for most stores, 50% of revenue. And so to lose that, I mean, that's a big deal, particularly on the Cape, where if you lose it in those important months, I mean, that's a killer. So I think it's really important to highlight that. This is not something that anyone takes lightly. Tonight we've been, and I think we should be speaking about the vaping epidemic, because it is, and I won't put it in quotes. It is. It's a real problem, not just here, not just locally, not just across the street, but across the country. And there are lots of reasons, and I'm not the expert on it. Why kids are choosing to use those products. I'm not the right guy for that. That's not what I do. But I think it's really important to remember why we're here. We're talking about a mint, wintergreen, and menthol ban in the town. And because the focus is the vaping. But it's important to remember that really kind of throws the baby out with the bathwater, if you will, because it captures all of those combustible products as well that adults enjoy. And 30% of a tobacco retailer's tobacco business is mint, wintergreen, and menthol. So just some quick math. If you do $1 million a year, $500,000 is cigarettes, 30% of that 50% is about $150,000. That's about 15% of total sales. That's real money. I mean, no business just snaps their fingers and replaces that. So again, I know we're here to talk about prevention and health, and I get that, but we're not talking about pulling a product out of stores that is relatively meaningless to the bottom line. We are talking about a product that is perhaps the most meaningful to a store's bottom line. So not that you would ever take this decision lightly under any circumstance, but I would encourage you to recognize that this is one that you would, this could really do some damage, depending on how much tobacco represents to a particular store's business. The idea that stores are marketing to kids, or even manufacturers, and again, I'm not here talking about manufacturers, I'm talking about the retailers, but the idea that they're marketing to kids, that's just not true. A, they can't do it by law, and B, I would ask anybody to show me how that's being done. I mean, it's a wonderful soundbite, but it's just not legal. So just keep that in mind. I think that's again, for the essence of time. I've actually gone longer than I thought I was going to. But I did want to just make sure that you understood the the potential business impact to this. Thank you very much. Happy to take any questions if you have any.
There are no time restrictions right now, so if you wanted to say something else.
I think I'd probably just be repeating some of the points that were already made. So again, for the interest, I love hearing myself talk as much as the next guy, but I don't think these people do, and nor do I think you do.
Okay, thank you for coming in.
Thank you very much.
Anyone else from the retail sector?
Thank you. My name is Mohammed, and I have a small business on Old Town House Road. I presented myself before that too. What happened is the stuff is already banned in Yarmouth. Those jewels, which is more appealing to the younger crowd, we don't have it to sell. We have only menthol and mint. Those are the two we consider to sell as per the instruction from the health department. So 70% of the business not here, it's out of the town. It's not in a Yarmouth, it's neighboring town. They are allowed to sell those stuff and we are not. And the younger crowd from the Yarmouth is suddenly disappear, trust me. Because it's not, because when we raise the age from 18 to 21, day by day, and store owner, I think, whoever worked behind the counter is the first responded for you guys to implement whatever policies we are come up with. And we are reply on every single, whatever the law requires, we are stay behind that. And that they suddenly disappear, and we don't have that clientele anymore, because the product they are looking for, we don't have it in the town, in a Yarmouth. That is the first things. They go to the other town, they buy it, whatever they're gonna do it, they can sell, is create another stuff they can create to buy to sell to other kids. Nobody knows what's gonna happen after that. So that's one thing, and the other thing is, the most important thing is create a black market, which nobody recognize that one, because the people can buy from internet or other towns, and they can sell in the neighborhood, even in the school, because if the guy have access to the other town, he can buy it, send the somebody adult, he can buy 4 or 5, hand it over to the kid, and they can go to the school and they can sell it. So there is no control on that one. We are doing our part as a retailer. We don't have that product. So menthol and mint is the two different things. Menthol have a more variety than the mint. Mint is a certain, like maybe it's only 2 or 3 product making mints, but the menthol is include the cigarettes and tobaccos, bags, and all the other stuff. It's a whole range of that one. So it's 3 different things. And one more thing is cigarette itself is the people make a choice to smoke menthol, so it's their choice. So I lost my customer yesterday. Usually husband and wife, they buy the carton on weekly basis. And yesterday he said, do not order mine. I said, what happened? He said, my wife ordered 4 cartons from Indian reservation. So we lost revenue. Government of Massachusetts lost sales tax. And what we get up? Nothing. So for the whole month, whole year, we lost everything. So he's not gonna buy lottery ticket from me, because he don't have to come to my store to buy cigarette. Along with the cigarette, he buy the soda, paper, bread, groceries, milk. It's a whole range of variety. So one customer produce so many business generate to the small businesses, which I think it's a little bit harsh for us to take it. Thank you very much.
Thank you.
Thank you.
How you doing?
Hi.
My name is Eli. I used to live in Yarmouth. My father owns a gas station and a retail store called Cape Cod Farms. It's off 252 Main Street. When you guys implemented the age range, it really did, take a big toll on our, profits and whatnot. And when they were saying that you can make money other ways, you make sense off of, candy and whatnot. So for you to make your money back, your 50% back, you're gonna have to sell a lot more candy and all that other stuff. And you guys always talking about the health of the public and whatnot. How many overdoses have been in the town of Yarmouth? If I go to McDonald's for the next 20 years and eat McDonald's and Big Macs, is that gonna be good for me? No. But it's a choice. So at the end of the day, it's a choice, and I think we as the people have the right to make that choice, and I think there should be a vote on it by the people, for let them come in, and don't do it at like 4 o'clock, do it at 7 o'clock, 8 o'clock when people get out of work, they can go in and do it and check on and see what's going on, And also, if I was a war vet, if somebody comes into my station and asks me for a pack of Newports, and I say, no, I can't sell it to you, I'm sorry, the town of Yarmouth doesn't allow it, how's that fair if he can go serve his country, risk his life, and that's all right? Thank you very much.
Thank you.
Okay, that's some good points. Thank you. Anyone else? You kind of raise your hand. Just someone else. Just don't have to ask permission. Just come up.
Hi, my name is DJ Orr. I work with a company called Colbia Enterprises.
What was it? I missed that. What is it?
My name is DJ.
No, the company's name.
Colbia Enterprises, okay? The reason why I'm here tonight is because we are looking at real estate in the area to actually open up a convenience store that in the town of Yarmouth. And so I'm here not only to represent my company, but I'm here as a father of two. I'm not here to say that anything I heard from the doctors and the health community is wrong. I believe wholeheartedly that they're speaking in good faith, that we have an epidemic on our hands and that we have a concern as a community with our youth. So I am here to tell you a little bit about, let me rephrase. I'm here to tell you what I'm not, okay? As a director of operations, supervising 100 stores, I'm not the tobacco company. I'm not the sugar company. I'm not a plastic company. I am just a simple retailer, okay? We contribute to the communities that we thrive in by contributing to the causes that whatever community is offering, whether it's charities or times of emergencies, we stay open. We support parents, we support kids, we support as far as being our employees and working with us. I don't want to talk in terms of business harm here because you're here as a Board of Health to protect the health of the public. So I understand that as a businessman, but I want to let you know that and pose this question for you, is if tomorrow you stop the mint and menthol in your community, do you really believe that that's going to stop our kids who are more tech savvy than you and I put together from getting and obtaining the vaping and the Juuls and the epidemic that we're looking at? And I would propose to you, no. You're going to cause business harm to us. We're trying to obey the laws, and I think we're doing a pretty good job doing it. The kids are not, from our standpoint, getting Juuls and vaping and tobacco from our stores. They're getting it from other sources, a lot of times from their friends and their family, okay? That's sad, but 80% from the statistics that we have on our end, that's where it's coming from. It's not coming from us selling to minors, okay? Anyone in this room right now can go online and order vaping or cigarettes online right this minute, okay? And we all know it. I think everybody realizes it. Our kids who are more tech savvy than we are can obtain my son bought a Nintendo when he was 13 years old, okay, without my permission. So these kids are smart. We have issues with our teenagers and our youth And my question, my proposal to you is, are we the problem that you should be looking at, okay? My proposal is no. I believe that we have a problem with our kids through education, as a parent came up here and spoke about. We need to get to them. We need to tell both parents and kids about the danger we have. And being only 5 states in the union that do not have the ability to have our law enforcement say, we're taking that jewels from you, all right, is no wonder why our schools are having a problem dealing with this from their level. That's my perspective, my opinion only. Thank you very much.
Thank you. Anyone else want to come on up?
I guess it's good evening now. My name is Cheryl Sabara. I am the Director of Policy and Law from the Massachusetts Association of Health Boards and their senior staff attorney. And I'm not sure where to begin here. I know it's not the retailers that are marketing tobacco to kids. I know they're not doing that. But I'm going to just tell you a little story. I watched the movie Lady Bird yesterday afternoon before the Academy Awards. And there's a scene in Lady Bird, I'm not sure if everyone's familiar with the movie, but it's about a young girl coming of age. And the day she turns 18, and the minimum legal sales age is 18 in the movie. The morning she turns 18, the first thing she does is go to her local neighborhood convenience store and buy a pack of cigarettes. First thing she does. She's finally that age that she can go and she can buy those cigarettes legally. The store, the cigarettes are all over the store. It's the marketing of those products in that store that's the problem. And it's not the retailers. I agree with the previous speaker. But it is the industry and the manufacturers. I disagree with the previous speaker about that. And so does the Attorney General, the Surgeon General, and so does every epidemiologist who has studied this, who has looked at marketing trend and where the money is being spent by the tobacco industry, and it's being spent in these convenience stores. So the attorney that spoke prior to me speaking did mention that the FDA is looking at this. Commissioner Gottlieb is livid, as are a lot of us, about vaping and what's happening with our kids. But waiting for the FDA to do something, I'll just give you one example about what waiting for the FDA to do something might look like. In 2009, the FDA enacted a regulation that required graphic warnings be put on tobacco products. It's 2019. 10 years later, we still don't have graphic warnings on tobacco. The harm reduction argument. I'm not going to tell a smoker that uses an electronic cigarette and doesn't smoke a cigarette because they're using an electronic cigarette, that that's not a good idea. My husband smokes. He quit for 20 years and he started up again. Would I rather he use an electronic cigarette right now? Yeah, I would, but he isn't. But when you look at the danger and the epidemic of youth use of these products versus anecdotal, because we don't really have good research yet on whether these are effective harm reduction products. Let's say they are, like the UK says they are. Let's say they are effective. They're effective, we don't know for how many people, but let's say they are effective. They're effective for some smokers. They're highly addictive and dangerous for youth. That's not a public health harm reduction model. I don't care what way you cut it. And if you're saying that because kids are hurt, that we also have this group of adult smokers that might be helped, the fact that the kids are using this is what the public health threat is here. We're not comparing apples to apples when we look at adult smokers versus a youth epidemic. Now, I would also add to this that we've heard that retailers in Yarmouth are great. I'm not denying that. I'm sure they are. I'm sure they don't intend to sell to minors, and rarely do they. However, there is national data that indicates that about 70% of the vaping products that youth are getting are coming from brick and mortar stores. We heard a parent who just testified that that's the case. And I think that that's all I really want to say at this point. But retailers are going to be affected if you restrict all flavored products, which would include mint, to adult-only retail stores. Adult smokers that want to get vaping products, I would suggest, are not going to be affected because they can go to an adult-only store and purchase a mint vaping product if you don't completely restrict them and prohibit them and just restrict them to adult-only stores. But mint should have been included in the 2009 FDA regulation that banned all flavored tobacco, except for mint and menthol and wintergreen. But it wasn't because of lobbying efforts that were done. So actually, the industry has been able to sell these products for 10 more years than they actually should have been able to sell those products. Many of us were advocating to include mint because, you know, if it walks like a duck and looks like a duck and quacks like a duck, it's a duck. Mint is a flavor. Ask anyone, is mint a flavor? And the answer will be yes. Thank you.
Okay, thank you.
Thank you.
Sir, come on up.
Good afternoon, members of the board. Richard Boyle with Cumberland Farms. I've been before you before. I'm a Dennis resident. My children were raised in the Dennis Yarmouth school system, and they were exposed at that point to many different things throughout their education, a whole different set of, call it, addictive risks that were out there for them as they grew up, just as each of us had. And yet, to mimic some of the things that were said, some of the best defense comes from in the home. And I would be looking at a utopian society if I felt that we could all achieve that right away. And I also think that that plays out here perhaps for the business impact that the restriction of the products you're taking under consideration can have for retailers. Cumberland Farms has enjoyed a relationship in the town of Yarmouth for some 50 years nearly. I've been with the company for 38 years. And though I have a representative set of products that I can follow along with the logic, the concerns, the worries, and the fear that parents have and you have as a board for this vaping epidemic, I also want to point out that I do think it's so very vital. I work in a lot of different communities for Cumberland Farms, and I attend a lot of different Board of Health hearings along these lines. And each community has an impact, and maybe a little bit less so in Yarmouth. But independence and the aspect of allowing the customers to make a choice, which is still a right of theirs underneath our legislation and laws, I think it's vital that we protect that. I am not arguing that there isn't a situation regarding vaping that is present in schools. You don't have to read too many journals to figure out that these are inherent risks. And without quoting other addictive substances and other risks to which our youth are exposed, we can pick away at them one by one, but we're also harming retailers in the mix. And I think it's a very, very deep wound that will be incurred by eliminating the different products that you're speaking of here. In Yarmouth, as one of the retailers spoke, we have been abiding by and living with the flavored restrictions that you put into place in 2014. And that was a whole getting accustomed to. Cumberland Farms, as a retailer, has taken a very aggressive stance with our team members. And we're all aware that Cumberland Farms did have a misstep with the town of Yarmouth, and that's something that's still being worked through. When it comes to these products, we have taken a stance with our team members that hits them in the pocketbook as well. We pay incentive to not only our managers, but also to our hourly team members. And we've recently adopted an aggressive stance that if a sale is conducted to a minor during one of our internal compliance checks, that we will terminate the employee. If they sell during a federal or local or other operation for compliance checking by the coalition here on Cape Cod, we will also terminate them. And on top of that, we will not pay for that quarter the incentive monies to those employees. Now, that's because we want to suggest to our team members just how important this is in our stance as a company, not just in Yarmouth, but overall throughout 600 stores of the chain. And I would like that you would consider the opportunity for the business people in your community to continue to allow the legal choices that are at the hands of consumers and purchasing things legally and with the proper identification under the guidelines that have been adopted as of 2014. And that's the point I'd like to make to you this evening. I'm available for any questions, and I'll sign in.
No, I appreciate that. I think for the record, it's important to note, yes, Cumberland Farms did take an aggressive stance, and the public may need a reminder of that Cumberland Farms sued the Board of Health here in Yarmouth.
That's correct.
Right, thank you.
Thank you.
Any questions, anyone?
And
From
we
here?
did win.
I'm sorry?
And we did win.
Okay. Into the mic there? Yeah.
Under appeal.
Very good. Thank you.
Okay, thanks for coming in. Good. Now's the time. Anyone?
Forgot to mention two other things. There was a suggestion made that you could require that products be placed under the shelves and out of the vision of everyone. I would just, and you could also restrict advertisement. I would just note that before you consider doing anything like that, you speak with your town attorney, because business does have a First Amendment right to free commercial speech, and any restriction on advertisement would violate that First Amendment right to commercial free speech. And also, when it comes to pup laws, I would suggest that you speak with your police chief, because since the Criminal Justice Reform Act became law in April, the police chiefs have been very hesitant and reluctant to encourage any more such laws, because they're basically not effective anymore since the Criminal Justice Reform Act has been in place. Thanks.
Okay, thank you. Welcome back.
Thank you very much.
Okay.
I just wanted to make two more points.
Sure.
The first, the suggestion was made that the retailers in town would be inconvenienced, but that the customers would not be, because they could go to an adult 21 plus store. Well, you don't have any in Yarmouth, so there were no vape stores. You would have to, and even if there were one or two, I mean, relative to the dozens of convenience stores, I mean, I guess it all depends on what your definition of inconvenience is, but most of them are going outside of town, number one. Number two, I would say on the purchase use possession laws, I often hear, well, if it just saves one life. Well, to me, if the police aren't going to do what they can to save just one life, well, then that's shameful. And it may be difficult to enforce. But I know my kid, if he knew, and I have a 16-year-old, so I'm in it right now. I have a 13-year-old and a 16-year-old, so I am in it. My guess is that if my son knew that something was illegal, it would act as a deterrent to doing that. And maybe it won't impact everybody. Maybe there are some kids that are just brazen enough to say, the heck with it, I'm going to do it anyway. But I'm fairly certain that a lot of kids would dissuade many kids from doing that. So just wanted to make those 2 points as well. Thank you very much.
Thank you. Director Murphy, we have one store in this town, don't we? For 21 or not? Is there one store that is it's restricted to 21 years of age for a customer or not?
All the stores are 21 now, age 21. So we have one store that basically sells predominantly cigars, but they're all age 21 now, so.
There's no difference?
Right.
Okay, thanks.
So to be clear, I'm not suggesting that you don't have to be 21 to purchase tobacco. I'm saying to enter.
Right.
No, absolutely.
In the one store we have does not have a retail food product like all these other ones do. So is that it's a little bit different,
so
but they're all age 21.
Okay. Thank you. Okay, so this looks like Ed. So what does this board need to do right now?
Okay, so
logistically,
this part of the meeting, as going over the board's methods, was for a listening education to let everybody speak on both sides of the issue. This is the second meeting of that, and now the board can discuss. You have a draft regulation on whether you wish to go forward with banning a vaping device and taking any action on menthol, mint, or wintergreen. That's a regulation that you have in front of you that the board can discuss tonight. And if the board does wish to go forward, it would go to a public hearing at the next 2 Board of Health meetings. Then the board would decide if they wish to go forward. So this has been the 2 sessions of listening, and if the board wants to look at that regulation, discuss it now. If that appears reasonable, then the next meeting would be a full hearing, and that would be on March 25th, and then there would be another one March 11th, and then there would be another one in April. So it's just continuing the discussion if the board wishes to continue the discussion.
Continue the discussion or go to a hearing?
Go to a hearing, right. So the board needs to vote on whether you wish to have a draft and go forward with possible regulations.
Right, that doesn't mean we're passing any.
That's correct. And you could go, the board could go to 2 public hearings and then still decide not to go forward.
I think that's an important point.
That's very important.
Thoughts? 5 members here.
I'd like to hear from the chief and maybe some more parents, personally.
Oh. Can't
Just speak up, they had trouble
I'm sorry.
hearing.
I said I'd like to hear from the chief and some more parents.
Chief of Police?
Our chief, yeah.
Okay, that's a good suggestion, sure. Anyone else?
To get the parents here today, what we did is we worked with the high school and had them send out a email communication to all the parents.
Like an all-call? Was it an all-call?
I don't know. I think it was an email. I'm not quite sure. So that would have just been to the high school. I don't think they did down to the middle school. So, the opportunity was there. We can ask them to do that again. If you wish to do that before you discuss, if you want to have another listening session, that's another option also. If we want to invite somebody from the police in, another opportunity for other parents to come in.
So,
do you have a person in the back?
Absolutely. That's what we're here for.
My name is Lynn Vecchione. I live in Dennis right now. But both my kids who left go to DUI. And I pretty much just hear what I hear from them, that it's rampant in the schools. And now they have teachers sit outside the doorways and this and that. And they even do this stuff in class. I don't know a lot of the logo. I haven't done a lot of research on this. I'm going to now because I've learned a lot about it now. But I didn't realize that it's not against the law. For like the police and the schools can't come take this stuff away from the kids if they find them with it. I know that's probably a whole different
I think there's
thing,
separate school regulations about smoking in school. I think drugs and smoking and alcohol is part of their policy.
So the principal was here and had a whole lot of devices,
yes.
so the school is able to do
Confiscate.
that.
It's the
They do,
school.
they're confiscated, but what you were saying about police, that it was too
Whether-
much
yeah. Whether the police can find, there's no state law on that.
state law. All right, I was just curious to learn more about that, and I'll research that more, and maybe if you do the calling through the schools again, or I recommend you do the middle schools like you did for the high school, you'd probably see a lot more parents come, because everyone I know is talking about it and how.
Did you find it education tonight, hearing both sides?
I did find both sides, and I see a lot of points on both sides, but I do agree that, you know, when you're looking at adult smokers that have been smoking forever and helping them cut down against the welfare of our children and what could happen in the future, I don't think it really compares either. But again, I see our points.
Right. And we are trying to work with both towns next to us, Barnstable and Dennis, to see if they can also address the flavored, just the general flavored regulations
Yeah.
to help also.
I didn't realize so much that, but I just heard the quick message, and I said, I'm going to go to that, and I'm going to make my kids go. And
Good. And
they
how,
listened.
how did you hear the message?
The call from the high school. And it was very quick. It said, if you want to learn more about the vaping and what's going on, besides what I've been hearing from my kids who don't do it and are, well, I believe them, you know, they're against it. Because I've raised them from the beginning. You know, I'm one of the parents, single parents who've totally against it. And my daughter will reprimand her friends, and she's actually dropped a couple. So I wanted them to maybe learn something from this too. So the next one, you know, any more information we can get, I think is great.
Thank you.
Thank you.
Yeah, thank you.
I do have one resource.
Just come to the mic once again,
Thank you.
otherwise.
I do have, there is one resource which some parents might like. It's just an article, but I would say that if you Google the promise of vaping and the rise of Juul, was a New Yorker article which really lays out the entire spectrum of the phenomenon epidemic that's for there. So it's in the New Yorker magazine. It was called the Promise of Vaping and the Rise of Juul. It's very good from a parental standpoint to read.
Thank you.
I'm going to the middle school curriculum nights in some townships to address this on the 5th, 6th, 7th, 8th grade level. That's where my target audience is, because I figure by the time 11th and 12th, and I can only speak for my township, the school resource officers are busy folks, and they're have other issues, school shootings being number one for this generation, that they worry about. I have a tough time imagining that they can police this. This is hard to police.
Okay, thank you again.
Thank you.
Okay.
Oh, wait.
Somebody else? Great.
My name is Vishal Shukla, and I own couple convenience store. So, in the beginning, we did mention board of members and even the director of health. We are discussing here about youth or banning or restrict the menthol and cigars and for the health purpose. So the question is, since we are 21-year-old town, we not, as a retailer, we don't sell anything to the minors. If we go and move forward with all the products like we banning, if 56-year-old comes to my store and if they says, I want the menthol cigarettes, it is fair to them to say no? That's the one question I do have for the board member too. Like, I'm with all the health issues, yes, I'm with that 21-year-old, I was with that flavor ban, yes, fine. But any adults, if they come to the store, are over 21 or over 50, if they says, no, you can't do that because town of Board of Health says no to the menthol, you have to go or I'm not going to sell it, so they're going to go somewhere else. If they go somewhere else, some other towns get the profit, that's fine also. But it is fair for me to tell them, we're not going to sell it to you. So that's the question. Please consider that question also, because it's not fair. If you drinking or smoking or chewing, or if you says just ban the flavor gums, just for example, I'm not saying, and either of you come to my store and it says, can I have this flavor of gum? I'm going to say no. But other towns will sell it. So it is fair to you guys, or fair, so that's the fair for the community? No. My thing is, anything we do, stop, please consider 2 or 3 times, or think about it, because it's not, like, if we're thinking about only youth, yes, I understand. And we are not selling anything to the youth. The parent did say, my son he's 14-year-old and he gets the pods, Juuling or whatever. But do we sell it? No. So it is not fair to us. They blame on retailer all the time. So if retailer is selling, we do the compliance check, we always pass. So it's not us who's doing it. If somebody else sitting outside or anything, or even friends come to my store who was 21-year-old and above, if they come and says, give me a pack of cigarette, I'm going to sell it to them. I did my job. I'm not selling to the minors. But if he does go outside our house and give it to them, and the kids underage smokes it, this is not my fault. And just like the sessions, like education and everything, we should have more sessions in a school, or in general public, or in a town meeting, big town meetings, about this, so kids can understand, or parents can understand. They cannot provide. If the parents provide to them kids, that's not my fault. So that's only one basic point I want to make. Like, if any adults comes into the store and ask me for anything, I'm going to say no. And if they're going to ask me, like, why the next store or next town sell it and you don't? So that's going to become all of us, like, why we are not selling to the, adult, to all the products. And that's my basic point. Like, please consider that. So it's not only, we are supporting the youth smoking restrictions, absolutely. But it is fair to the adult to not smoke, or what they choose, or what they want. Thank you.
Okay, thank you. Okay, once again, the board, we have to take some action tonight. We can go over it again. Does everyone understand the decision we need to make?
Well, I think, just to clarify, the board consider going to March 11th for another listening and education meeting, and inviting a representative from the police department and maybe another speaker, and inviting additional parents, or making it available to the high school and the middle school before deciding whether to go forward with the ban.
Well, excuse me, it's not to go ahead with the ban, it's just to go further looking at the draft, right? It's not going ahead.
Correct.
I mean, the whole board could vote against it. It's just that it's moving ahead, I think, to be considering the draft. I mean, someone who, let's say, makes a motion and someone who seconds it doesn't mean they're in favor of it. It would just be taking it to the next step for a public hearing.
Correct. But before we
Right, but we're
did
saying
that,
not a public hearing, we'd like to have one more.
Right, those two things are different, yes.
Yes.
Yep. And also maybe have a middle school representative person come. We heard from the principal of DY, but someone involved with middle school administration.
Yes. And I think what we've heard is that some of the parents have found this educational and helpful, so we would need to look at getting another speaker that would also be educational, which would be helpful. I know Dr. Spillane's been very helpful, but we'll have to see who else is out in the community.
It's great,
that would
regardless
be
of what this board does with this, it's educating the board
Is
as well
getting
as
that
people around
message
here. and listening at home. So, anyone want to make a motion? We can maybe move forward down the agenda here a little bit.
Okay, go ahead. Well, it's me. I move that we have another listening session on March 11th, invite, do an all-call again, and include the middle schools, trying to make it brief, a representative of the police department, and any speakers,
Health
speakers to the subject that we can get.
I second.
Okay, any discussion? So all in favor of the motion, raise your hand, please, and say aye.
Aye.
Aye. It's unanimous, okay.
So at that meeting, as this meeting, would you want me to put the draft on for discussion again after that meeting, or?
Sure, absolutely. And anyone who wants to send material in, please do it. We're trying to get educated. It's a tough decision. It's complicated. So we'll do our homework, but, just provide us with information.
So Jess, if you can get me hard copies, the packets go out Thursday, so like on that Monday or something, or if you can get them sooner, or you have the ones that you want to leave tonight?
I have them tonight.
Perfect. Then they can start reading it ahead of time.
Yeah, literally, it's close to 300 pages there. I mean,
It's a lot.
there's one document, it's 250 pages. I'm working my way through it, but we need the time, so, let's just get it here, all right?
Certainly. And my
Thank you.
intention was to provide the support for the assertions in the letter. So, there's specific citations in there, but I think it would benefit the board to view the context, the larger context of the citation. So, it's kind of that you more responsibility with this.
Okay. Great, thank you.
Can we just take a 2-minute recess as the room empties?
Director Murphy, we can do that. Thank you, everyone, for coming in.
Thank you. Endorsing.
I mean, the only place it's bought is convenience stores, and there is one store. I'm not going to give this, but it looks like it's changed the way Bruce was describing. You don't want to give one business all the.
Who seconded your motion?
So there's
I missed it.
one person selling devices.
I already have one. Yeah, it's got a
That's
couple
where
more
to go.
changes.
Is that one different?
Depends on what you.
Yeah. A lot of towns still haven't done the flavor thing yet. Yeah. Dennis has in Barnstable.
Some light reading. Seriously?
It's different.
Is our chairman missing at this point? I think so. Do you think he wants to be present? I mean, the other one.
He probably does, but if you want me to get it going, I can certainly just
Get it going.
delay
Yeah,
this.
absolutely.
He's
Just
going to
tell-
just throw it to you anyway.
Just just blame it on us. The board asked you to start, okay? Let's-
The big shoulders.
Okay. So, okay, yeah, we have. So the fourth item on the agenda, this is a variance request for 1329 Route 28 in South Yarmouth. It's a septic repair. And our chairman, our director has returned. Anyway, okay, so do you want to speak first? Do
have some green cards.
Yeah, why don't you bring those over here?
Okay.
I can start off. and
For a
give you
kickoff, you want to?
give you a,
Yeah, that would be helpful, I think.
quick
for the board.
Bill, you can sit right at the table. You can move right up. All three of you can move right up. Yeah, we'll move the whole row right up.
Yeah, we're the only ones here.
Yeah. That's one way of looking at it. You got 3 people, 2 mics, so just make sure you're speaking into it.
I will let the owner of the property go into any additional detail, but I believe he is in the process of refinancing, and as a result of that, he was required to do a septic inspection, and that inspection was done by a state-certified septic inspector, and the system failed. And that is the reason why the septic system is being upgraded. And the reason why the septic system is before you tonight is we do have some setback variances. And the ones that triggered your review specifically, as our policy has been for a good number of years now, is we do have a variant setback to a drainage structure in Route 28 that ultimately leads to Bass River. So we have a variance to a drainage structure that empties into a wetland. The septic system is designed for a total of 165 seats, which is indicated in the system design on the plan. And the system has been designed for that total capacity. As you can see, for the size system that's needed, the site actually is kind of small. Pretty much squeezing the system in as is, and that's the result of the setback variances that are being requested. I think what I'll probably do is turn this over to, as far as my opinion, the variances that are being requested are pretty routine. This board and our office have typically granted them, and the reason why we do have these setback variances is I think the last upgrade was in 1985. We've had a Title V code change since then, and the systems are considerably bigger than they used to be under the 1978 Title V code. So as I had mentioned earlier, we're essentially shoehorning this in to fit into the available area that we have to work with. So let me turn it over to the engineer, and he can give more details along with the owner, and I'll certainly answer any questions that you have for me.
Thank you.
Good evening, members of the board. My name is Dan Ojala. I'm a land surveyor and civil engineer with Down Cape Engineering in Yarmouthport, and helping the Doyle's Restaurant out with permitting for a septic system upgrade. With me is Steve Cook, who is helping the owner out as a project manager, owner's rep, and Bill Supernaut, who is Doyle's owner, longtime owner, and business owner here in South Yarmouth. So it was a septic system inspection. It was, again, it technically did fail a septic inspection, but it's not the sort of thing where there's any health hazard immediate, and that there's never been a backup, nothing on the ground, no source of contamination that would injure anyone, but the system is getting tired under the surface, and so it was maybe perhaps somewhat fortuitous that it was noted so that we can design a proper new design and gear up to solve this with a semi-permanent solution. Obviously, long-term, if the sewer runs by, a connection into that would be ideal. But in the interim, we've met all the new modern 95 code requirements with only a few what I would characterize as modest variations. The tank size with the code change went up quite a bit. You need about 300% of the design flow versus the old 150%. So you've got a lot more tankage in the ground that's got to go in. The grease trap was actually properly sized for the flow already, so we're able to reutilize that. But we've got some new, bigger tanks, and with the newer, lower loading rates or larger leaching fields that are designed, the systems with the newer codes tend to spread out because you can't use the effective depth that you used to, even though there's a good distance to groundwater in the site. And also the pressure dosing works very well with a bed system, which uses only bottom area. And so the size of the systems has gone up quite a bit. You can see by eye it's almost probably 50% larger than the old one. But for the environment, that's a good thing. For the owner who's paying for it, it's a bad thing. But overall, it's it's going to be a nice system. We'll split the flow up. The new code calls for pressure dosing for anything over 2,000 gallons a day. And as Amy said, we're looking at about over 5,000 gallon per day design flow. Doyle's doesn't physically use that much water. They certainly don't, but It's a mixture of bar seating and inside seating, and that's the design estimate, which is typically at least 200% of the highest day's flow, and generally, and it's probably even a little bit conservative with respect to that, but we're able to sell it to a 99 or the next guy. They might possibly use close to that much water, so we've designed a fully compliant system. If it physically really didn't fit, we could go for a 25% reduction, but as you can see here, with just a couple of modest variances, it does fit all the code requirements for the distances from the lot lines, from the building. It is a little bit tight on one of the drainage structures, but what we've done to mitigate that is put in a vertical liner, a plastic liner, and that's generally what we're doing here is we're pressure dosing the leaching fields. That's another newer code requirement, but it does require a big, expensive duplex pump system. But then it'll spread out like a lawn sprinkler over the entire leaching field. The old days, you'd channel it, and maybe one of the D-box outlets was a little low. It would take all the water, and you'd pond in one area, and that could potentially create a channel where you'd have saturated conditions, and the viruses could get down on the groundwater table and cause problems. So pressure dosing solves that by spreading it out like a lawn sprinkler. Again, you're basically charging up a manifold, which spreads it out to a bunch of laterals, which spreads it out to orifices. So all those dots, you'll get a little spray of water in each one of them, a gallon and a half or so per minute flow, and it'll wet the entire bed at once and then turn off, and that wetting front gradually goes down and it filters out. They find a very large percentage of the pathogens in the biomat, and it doesn't saturate any one area. So having this new pump system is definitely going to be a nice improvement over the older style system that's there. So that's a net positive. The parking lots in the front and the back were just large enough to contain. We split the flow. There's one pump that feeds the field to the south, and then there's another pump that feeds the field to the north. They alternate back and forth, so each one will, when the level, the pumps alternate so that the fields are basically dosed the entire daily flow 4 times a day, so each one would go half that. And we do find that vents are needed underneath pavement. One of the new code requirements is to keep the systems up close to the surface, so we do meet those codes. We're not more than 3 feet below grade, and we run a good amount of venting down the systems, wire them all together, and then come out near the lot lines with some vents to help some air circulation and keep the fields aerobic. It tends to make them last longer. Putting some charcoal vent filters on there. So specifically what you folks would look at this is that's all pretty much routine and what you would do, and we wouldn't need to come to you, but the under maximum feasible compliance, when it doesn't fit like in this site, we're asking for some variances under section 15405 of the Title V code. Under 1A, reduction in setback of the tank to the lot line, that's 10 to 5 feet. With these new larger footprint tanks, we need just a little bit of a setback relief there. We've got a SAS to the drainage structures under the next section of the code, 25 feet to 18 feet. And again, that's going to be here, but as I explained, we've got a vertical membrane there that will prevent any horizontal flow. As I described, we really wouldn't expect that. We're distributing the flow over the whole field, and it tends to be gravity pulling down a very vertical flow, but just in case, we've got that liner. So I feel that the board could grant that variance and feel that they were still supporting the spirit and intent of the code. Reduction of setback from the water line for the grease trap, that's just kind of a technicality, but 10 to 7 feet, that's existing condition as best as we can determine in this area. It's a sealed, high PSI line, but just to be careful, we'd like to not disturb that and have you allow that variance of a few feet to that code. Reduction in size of the first compartment of the tank is kind of a minor. I don't think we put that on the formal application, and Bruce and Amy are pretty comfortable with it. But you need, again, 300% of the design flow tanks upstream of the pump chamber, and we do have that. We've just split it slightly more into the second compartment than the first. But again, it's only about 1,000 gallon difference swing. We do meet the full 300% flow, so I think the spirit and intent is certainly met under that. And then local regulations, we're looking at Section 3.7, reduction in setback SAS to a subsurface drain, which does drain off the site to potential wetland. And a lot of these systems the town has done a good job on, and they capture it and they infiltrate it into the ground. You can see a chamber there, but then if there's an overflow, it's our understanding that it does head out towards the Bass River. So would technically need a reduction in that. Again, the flow tends to be very vertical and not horizontal, so we don't feel that there would be an interaction between the two, and that you could grant that variance with the confidence that what you're getting here is a better system than what's there now, and that the environment would be protected. If we could talk for a minute about the timing of it, again, there has been no breakout. There's been no health risks that we know about whatsoever to date. What we would like to ask is for some time to put this in. When the process of getting some bids are extremely expensive, and as a local a businessman who is trying to make ends meet, we would be hopeful that the board could look at about a year extension on or perhaps 6 months from when the code would say extension on the installation of this. We're getting pricing together. We'd like to go through the next summer and fall. And again, if we put in a program where Cape Cod Septic is our routine pumper, could pump it again this time of year, it's simply not a problem. But in the summer months, if we want to be very conservative, we could propose maybe after June and after July and after August, we do a full tank pumping. That's a 9,000-gallon tank. It gives the leaching a nice relief, allows everything to settle in, and would guarantee that we wouldn't have any backups. We would appreciate that. One thing that I thought of perhaps would be a nice safety valve on this is that the way systems fail is that, the water flows through by gravity. It's a gravity system. When it starts to back up, the water will come back up the pipe and start to flood the tanks, and then it'll flood a little bit higher, and it would flood into the sewer, into the system. And that would all be before it broke out of the ground because it's several feet down. If we put an alarm level in the septic tank and mounted a little simplex alarm panel on the shed, which would be perfectly willing to do, we could sense if that water in the tank actually ever did back up more than a few inches above the normal operating level. An alarm would sound and would know to get the tank pumped. And that way, long before there was a health risk of it breaking out in the ground, we could address it. The way the system has been working now is basically, the field is tired, but it's still working. The level goes up and down. So if it ever does back up, that would be the canary in the coal mine. The alarm would go off, the pump trucks would come out, pump it down, and there would be no health risk. So we'd like to, if the board would indulge us, have a year, and what we're talking about in May, perhaps an installation of next year. Again, we're not for us refinancing and just getting some operating money together. We don't know that it would have ever, failed. It's been going along like this for many, many years. As far as we know, it's been just fine. And certainly we'll work with the health department. If there is any, significant sign of an earlier failure, we could address it. But it's sort of a technical failure where it hasn't backed up or caused any problems. It's just a matter of, the leaching field was saturated enough that it did technically fail the inspection. So with that, I'd close and be certainly glad to answer any questions. But if there's any way the board could find their way to, grant these variances and a time extension until May of next year, we'd appreciate it, contingent upon perhaps an addendum sketch showing that alarm, the overflow alarm, and routine inspections by Cape Cod Septic. We sure would appreciate it.
I just would like to say one thing. I have $40,000 in an escrow account for this project, but I didn't know it was going to be this big. So I don't know how much equity I have left. So we're going to get a bunch of bids. That's going to take a while. Now, if I could go get financing before that, I would do it before then. But I don't know where I stand with that. I would want to get it done as soon as possible, but I don't know how much. I have $40,000. This is going to be a lot more than that. And then once I get a good bid, or the best bid, I can see if I get financing, and if I'll go from there.
Any thoughts of potential surprises You may find when you start opening this up, just based upon the history of it, location.
One thing that I just, I had a few minutes before the meeting to look through my file with that other presentations, but I did see that there were some older houses in the front here. We could hit a little foundation, have a little bit extra soil removal in the front. So there could be, a couple little curveballs back in the 30s. It was very, very old.
Oh, I'm sorry. There's no houses around there. I didn't know what you meant.
It was historic. So sometimes you run into that with an older site.
You mean on the Route 28 side?
Yeah, a couple little cottages were in there, but you wouldn't expect those to have much of a foundation, but that would be the only thing I would really think. But in terms of, was that generally the question on a construction side? This is a nice site, like compared to the Howard Johnsons, it's just under construction now. That one had, very high groundwater, peat conditions that were tricky. This is a cream puff compared to that,
And quick question, you would recommended having it pumped every month, June, July?
During the peak months, if you're going to be concerned about it, I think that's when you get the 8 weeks of summer.
Not really that.
It hasn't,
If it needs it, but if you want to do it that way, I don't know, the summers are shorter and, they're not as busy as they used to be, and the winters are longer, trust me. But I'll do whatever. I mean, I'm going to get it all. I was
going to say, Bill, don't you have a contract with?
Yes.
With Cape Cod Septic? Don't they manage that for you now anyway?
But I'll be honest, I had a problem. Last year, I talked, Cape Cod Soda, I canceled them, and she canceled Cape Cod Septic, and I called him and asked him why not. It hasn't been done. So I straightened that out, and I talked to him about 3 months ago, and I said, go take care of whatever you got to take care of right away. So we're going to take care of that tomorrow. That was extremely an accident. But I'm not even going close to that water. I mean, but I know that's what you have to have. I mean, it's pretty slow everywhere, as you well know.
Yeah, but my question is, I think you have a routine maintenance with that
I always
company
have. I had
anyway.
Robert Orr for years, and then I have Cape Cod Septic.
Yeah.
But I've always left it up to them because I'm so busy. I was always on a schedule.
Yeah.
Somehow the last schedule got screwed up.
How does financing work when you don't know whether or not tank has to be replaced? I mean, that's a significant amount of money. You won't know until you take a look at it. How does that work with financing?
There's a lot of information on these plans for the bidders to digest and look at, and they've got to, check the, the phasing of the AC power, some things like that are, take some time to quote. Generally, though, the quotes will come in a fairly good cluster. Everybody, pretty much understands the routine. There's always some clauses in there. If there is extra soil removal required, there's strip out on all these. The paving is expensive. Those prices vary a little bit, but usually we'll have a construction escalation clause in there for that. But it'll take a little while to get the monies together. But again, this is a stable situation right now. He's not a high water user. If you pump it down, it's going to be a long time before it fills back up. So I would feel very comfortable if I was on the board allowing a year and a couple of months. It does have to be done, and we recognize that, but it just doesn't appear to be something where we have to rush out and screw up our spring and summer, rushing to do something that, could easily wait. So that was our hope.
As far as the tank, I mean, there's always, anytime you're working near older components, there's always the risk you're going to damage it with the heavy equipment, because we are going to be working right up against the existing tank and the grease trap. But I think, Bruce, you have the copy of the inspection report. The tanks would have been inspected as part of that report, and if there were any issues with it, that would have been labeled in the inspection report.
Okay, thank you.
Couple questions, Dan. Just on one, on the septic system on the Route 28 side, where you're close to the Route 28 drain going in there, you're 46 feet away.
Sure.
Could we put a liner on that side? I mean, you got a liner on the other side, Mill Lane side, but maybe, because that one goes directly down to Bass River.
Yep.
So maybe just that top, like a wraparound there a little bit.
Yeah, couldn't hurt. We'll have the hole open anyway, so a little bit of liner.
So
I think that's reasonable.
Yeah. On the inspection schedule you have listed, which is fine, but I'd like to include the engineer to do the inspections, just not rely on the health department.
Yeah.
So if you could just add engineer to that.
I mean, that number 13 on the first page, that was one of the notes they had to add to it.
Yeah. Well, then clarify that on the second page where I was looking at under inspections. The Board of Health should require the following inspections. So a lot of times that says engineer too. I just want to make sure we're both out there. So do we usually get an as-built plan, or if it goes into plan, we all set, or?
You can also provide the as-built septic plan. That's on the front note.
All right.
Board members, comments, questions, motions, something? Anybody?
Last point?
Yeah?
Just to
Oh,
jump
great.
off, I liked your idea of installing an alarm. That would keep an idea on it. I think that would help us. I know pumping the whole tanks, 9,000 gallons, is going to be expensive. So I'm just wondering, I mean, obviously, I'm not thinking of doing it 3 times, but maybe in July and having it checked. But I can see pumping it down, putting an alarm. But I think we should get maybe a letter from you of what the steps you're going to do. You're going to install an alarm, so we know where that's going to be installed, and that it will be inspected and pumped in July or August or something.
Yeah, that sounds reasonable. And with that alarm on there, you'll know if there's a problem, and we can pump as needed. So
Right.
I think that's, it would be.
And maybe you just pump it down. You don't pump it all the way down because,
Especially we're doing a pumping right now.
Yeah,
so,
but-
yeah.
Yeah, why don't I just do a pumping, because what I try to say is, it got screwed up, so I need to do a pumping right away. But I just did the
grease traps.
The grease traps.
Yeah.
But I would do this, I would order Cape Cod do this immediately, and then let them look at it in July. 'Cause
Yeah.
June's bad too. May's bad. It's not like the old
Right,
days.
right.
I mean, if it needs to be done, it needs to be done, but I'll do it immediately. I'll clean it all up now, and if we could stay on top of it and look at it in July. So I don't want to wait until July. I'll clean it all up now.
So you're looking for an installation date of May 2020 then?
Yeah, not unless I come in with a bid and go to the bank and I don't know, I might be maxed out right now, because
Okay.
I didn't think it was going to be this big. There was a miscommunication with a few people, but I guess once the engineer got into it, I didn't know it was going to be this. You told me a couple weeks ago it was going to be that. But I was put me in a state of shock, so.
I didn't want to put you in total shock, but.
Yeah, so, yeah, what it is, what it is. But what I want to do is get Cape Cod Septic to get it all cleaned as soon as possible, this week, whenever they can schedule it, then we'll look at it again in July.
I think that makes more sense. I mean, why waste energy, pumping and moving things when there's not a problem,
Correct.
With that alarm on there, that'll let us know if that level goes up even 1 inch over the normal operating range, then we'll pump if it needs it.
Now, how long would it take to put this system in? This is a pretty elaborate system. Is this a 2-week installation, do you think, Dan?
It depends completely on the operator and how big a company there are and how many crews are on it. It really does depend, but I would expect, like the one they're working on now, of course, the place is closed, so it doesn't matter, and they're pecking away at it, but it's been months, Yeah, the quickest I would expect this would be 2 weeks, probably, from saw cutting to finished paving. It'd be a good job if they got it in 2
Then
weeks.
during that period, you'd like to stay open, or, you got a lot of trucks going around
Well,
here.
hopefully, I could get a decent bid and I could get, well, they stopped that thing that Teddy got, that's where my luck's been going, but anyway, if I can get a bid and I can go to the bank and get a loan, the bank's still gonna talk to me, I would just close in February. You save money closing. Why is everybody closing now? Because it costs you more money to open. If I can get the financing, the rest of the financing with the bid that's approved, I would close for 2 weeks in February. If I close the Super Bowl, there's nothing out there. That would be perfect, if I could get the financing.
Okay.
The paving might cost you a little more, or it might not be able to be done that time of year, but we might be able to reopen with a hard pack gravel and then, pave when the weather broke. But that would be ideal, and that way it would be a little bit less stress,
Anyone going to go ahead? Look a motion here? There are like 5 or 6 things here to list.
I move that we approve the variance request for the restaurant at 1329 Route 28, South Yarmouth, to include in addition that Cape Cod Septic pump immediately and then check it again in July and pump as necessary, that there be an overflow alarm installed, as well as a liner on the Route 28 variance location, that the inspections include an engineer as well as a health department representative, and that the work be completed by May 2020.
End of May? We'll say end of May.
End of May 2020.
Sounds good. Yeah, that's good. Perfect. Give a second to the motion?
Second.
Okay.
That we're going to work for you, Bill, 2020?
Yeah, I hope. Perfect. Thank you very much.
Discussion, anyone? Good discussion list? Okay, so all in favor of the motion, raise your hand, please, and say aye. Aye. It's unanimous. Okay, good luck with it.
Okay, thank you.
Thank you very much.
You want them both?
Not just the new one.
Just
Get rid of them if you want to give me the other. Sure.
It's pretty impressive. Yeah. This is a big one for my first. Discuss it next. All right.
Kids, worse than kids, I'm telling you.
Okay, let's go back to the agenda page, everyone. You can see number 5 is Parkinson's Support Group 2019 schedule. Mr. Murphy.
Just an update for the board. That was one program that the board's public health program's putting on up at the senior center. And they just wanted to let us know that's going on. And when they put it out, they do acknowledge the Board of Health is operating a public health program up there.
Okay.
How many people do they have?
They can vary. I'll have to check with them, anywhere between 20 to 30, 25-ish. So it depends on the speakers and how things go, but it fluctuates good. If you go into the front door of the senior center, there's a sign out there. It says Wellness Programs by Board of Health. So the board does get good notice.
Okay, 6th item is approval of the minutes. That was a meeting from January 28th. I had just sent Christine 1 or 2 simple things. Anyone else have any edits they sent in or need to?
I didn't send anything in, but I apologize, but I thought I remembered that we asked Mr. Hook what we could do to help, and we decided that we would recommend to the selectmen that the revenues that come from this be dedicated to an additional position.
We will.
But I mean, I didn't see it in the minutes.
Oh.
But we did talk about it, I know. So I don't know if that,
We don't approve the minutes, and we bring them back?
Yeah,
Yes,
we can
I
put that
appreciate
sentence in.
Yes, let's do it that way.
Yeah.
Which is fine. Otherwise, it look great.
yes, otherwise, sorry.
So, all right, so we'll review them at the next meeting. That's fine. Okay. Any old new business? Mr. Murphy, you're speechless at this moment.
No, the board's doing very well. The next meeting will start at 4 o'clock also, because we'll have the historic coming in after us as tonight. And I'll work with, see what we can get for speakers and coordinate that.
All right, we'll figure that out.
Yeah.
That's fine. Anyone take a look at the 8th item on the agenda?
I move that we adjourn.
Oh, what is it? I second.
Okay.
3rd.
4th. Everyone okay with that? Say aye, aye. Okay, aye. Okay, adjourn. Thank you, everyone.